Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. In this segment, we're going to be speaking with returning guest, Mr. Ken Cahill, CEO of SilverCloud Health, returning on the show to talk about how they're responding to the coronavirus epidemic with the increased demand for effective mental health treatment. Welcome back to Health Professional Radio, Ken. Thanks for returning.
No, thank you, Neil. Thank you for having me back on. Thank you for the opportunity.
Yeah. Well, it's been a couple of years since we talked about mental health, and you were talking about then the access to mental health online and how beneficial it was going to be. Where here we are, fast forward to 2020, and it seems that most health is being conducted online as we speak. What's new at SilverCloud after you give us a brief background about yourself?
Yeah, certainly. So my name is Ken Cahill. I am the CEO here at SilverCloud Health. Devoted father of two young boys, and a very loving and caring wife, which I think most entrepreneurs will need to have. What's new at SilverCloud? I think we spoke back in October 2018. So since then, we've gone from approximately 115,000 users on the platform. So 115,000 users at that point in time from when we spun out of research. So we spun out of research in 2012 to form SilverCloud. And that research was looking at how can you deliver online access to mental health care in a more effective way. Looking at the big challenges that were there and still are there, which are low patient engagement, high patient dropout, and limited clinical improvement. So we spun out that research in 2012. So between 2012 and 2018, we had delivered the platform to some 115,000 end users, clients, patients, depending on your terminology. Today, we're now up at about 450,000, and we're onboarding around 50,000 a month. So, last month was more than we did in all of 2016. The month prior was more than we did in the entire 2015. The month prior was all of 2014. Wow. And, there's no two ways about it. Of course, the COVID-19, the coronavirus, has impacted the uplift in terms of those user numbers. But January was our largest month ever, as was the December beforehand. So the trajectory was there. I think like everybody, we're all living in challenging times. It's very different than where it has been, and we, as you say, all healthcare is being delivered virtually. I think all parts of life are being delivered virtually. And that is providing, greater and more even and more fairer access to an awful lot of facilities. And also it's just a requirement of what we have. So I think going forward, we will ask ourselves some of the questions. I mean, this is the longest I have been in 10 years. This is the longest period of time I haven't traveled on an airline. Mm-hmm. And I'm not sure if we mentioned in 2018, but my passion and my love is airplanes, and I always want to be a pilot, but I'm 6'9", so I'm actually too big to be a pilot, too tall to be a pilot. So I've always had this affinity with aviation, and I've kind of watched it as almost a barometer of the world, as we see more and more airlines come out, more and more routes, more and more flights, and that then just to be decimated overnight. And the knock-on impact in the managers of those airplanes and the servicing and all the different parts of industry. And I think that's almost like a lesson for every part of what we had. There's been just such a significant change. So I mean, personally for me, this is the longest I've gone without being on an airplane in at least 10 years, I would say.
Huge changes.
What we will start to do. Yeah. What we will start to do is we'll start to question, why are we on an airplane so often? A virtual meeting is almost as good as an in-person meeting. Mm-hmm. And if the other party wants to do virtual and you'd kind of like to do virtual, let's do virtual. I think that's a lesson for delivering and access to mental health care. I want to get access to mental health care. I can't. Really, I'm under pressure in work as it is. I can't block out extra time on a Tuesday in 4, 6, or 8 weeks' time in an afternoon and take that time off. And, that therapist might be X amount of miles away from me, and the journey time to and from, and I have the kids, and I have this, if I sort of, on average, people with depression will be living with it for between 10 and 13 years. Apologies, with depression, we'll be living between 5 and 7 years, and with anxiety, we'll be living with it between 10 and 13 years. So when they come to a point of realization or acceptance, dare I say, and they want to reach out for care, they're looking for care now. And that's what digital can do. That's what we do at SilverCloud. We provide earlier, easier, on-demand and immediate access to mental health care, which is, very much of the now. In the same way as we look at Blockbuster Video and think, you ask a generation now, they would ask you, well, why did you do it that way? Versus Netflix and other service providers. I think we'd be asking the same questions of ourselves for healthcare delivery, be it mental health or otherwise. Virtual, whilst it won't always remain fully virtual, I think we'll see an awful lot of it will remain virtual going forward.
You talked about many of the challenges that you faced back, 2012 up through 2018 with patient engagement, dropout rates, things of that nature. And then you spoke briefly about the challenge of the sheer volume of use due to COVID-19. How has the pandemic specifically changed the way that you work now? What types of things have been implemented immediately that you're seeing now? Maybe we could have done that years before, but based on the urgency of the COVID-19 pandemic, some things fell into place easily.
I think there's a couple of ways of answering that question. There's one, from within SilverCloud itself. So we're a team of 70 people. We have been, like most organizations, we have a number of kind of major offices around Europe and indeed around the US, and we've kind of used them as the sort of central point of pulling people together, and that's eroded over the past number of weeks and indeed months with what's happened, and people have gotten into now a stride. But their own challenges have come up with remote working as well, connectivity with other members of the team, tools and having the right tools. Communication's been, an important point to keep pushing on as well. External to SilverCloud, then, if you will, or what SilverCloud does out to the world. One of the things that we did as soon as we kind of, saw some of the first waves, and I suppose we had maybe a different or an interesting insight in terms of time, because we would have about 290 healthcare organizations across US, Canada, Ireland, the UK, Germany, Switzerland, Austria, and a number of other countries across Europe. So we saw this wave coming in and hitting certain customers and partners across Europe ahead, I suppose, of the US. And so we found ourselves receiving a lot of phone calls from a lot of government organizations, state organizations, federal organizations asking for support and help for, citizens in terms of care and care delivery, as they kind of saw waves of people coming in. So what we did immediately was we spoke to our customers and our partners. We asked, how can we help? How can we help? And the concern they had was, very grateful of the offer of help, but, in kind of, disaster relief situations, the worst thing that can happen is all the sort of, non-government organizations come in and help at the same time, but they'll end up tripping over each other. Yes. And then kind of cause more harm than anything else. And, the immediate reaction from all the health systems was, first, can you help us with our own workforce, with our own employees, with our own team? And we said, of course we could. And that was kind of repeated over and over again. So what our teams then went and did in a 16-day period of time, created a new program, which got vetted, researched and trialed, a program focused on COVID-19, focused on living in challenging times was the name of the program. And that program was incredible what was created in that period of time and utilized, focusing on things around isolation, self-care, even touching on loss and bereavement, and those challenges that exist, along with the anxiety that a lot of us would feel right now and have done over the past while. And we got that into our customers and indeed our partner organizations' hands. So whereby we spoke to those organizations and we opened up the platform to around 180 million extra lives were getting and provided free access to programs around stress, sleep, resilience, and indeed living in challenging times. And that was really well received, as you can imagine, by the healthcare organizations and the end users. And we got energy from that as well internally by seeing some of the feedback that users were giving to these people who were on the front line, who were delivering care. And these were people who were delivering care, but we importantly provided access to those caregivers, those frontline healthcare workers, and their family members. And that was important because, some of the harrowing stories that we heard was, a spouse whose other spouse, if you will, was working as a frontline healthcare worker, and they had to live in the basement. Yes. They had to buy separate food for each other, and it sounds corny, but, they weren't able to be, even to hold hands for a 3, 4, 5 week period of time. And that has an effect on all of our mental health. I've been fortunate not to be exposed to that level, but I know myself from a mental health impact, I think we can all attest to it. Simply watching a television show from 2 years ago or even a year ago, how dated it looks today when we see a bar scene or a restaurant scene, and we see the lack of social distance that's going on, and we kind of go, ooh, that's not right. Our minds have been forever changed, if you will, in terms of what's appropriate, what's personal distance now, what does it feel like if you go for a walk, depending on where you live in the world. You may be encouraged or may be forced to wear a mask once you become within a certain number of meters or distance of other people.
All of that.
That has an impact.
Yes, it does. It has a severe impact on mental health, well-being, securities, and the lack thereof. Give us a website where we can go and learn much, much more about SilverCloud Health.
Yeah, certainly. So our website is SilverCloudHealth.com, and on there you will see and find out all the information about SilverCloud, about the digital mental health platform that is SilverCloud, and indeed case studies of how we do what we do in terms of delivering outcome, scale, and access for mental health.
Ken, thank you so much for coming back, speaking with us. It's been a pleasure, and I'm sure we'll be talking again, especially as digital healthcare goes even more widespread.
No, absolutely. Thank you, Neil, and to you and to your listeners, stay safe and stay well.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Ken Cahill, CEO of SilverCloud Health. Audio copies of this program are available at hpr.fm, healthprofessionalradio.com.au, and you can also subscribe to the podcast on iTunes. You can listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.